Alright, so this is the last part of my presentation. I'm going to continue talking about the barriers. So the work environment and the availability of childcare can definitely be a barrier to a lot of women, especially the working mothers. So some of the problems commonly reported include having no time to pump at work, having no place to pump, having no area to store the milk, being unable to find childcare near work, and having job insecurity. And one problem not mentioned, but I think might be a problem, is when women do pump at work, it that time taken to pump is usually docked from their pay, which can be a problem for some women who really need their hours if they're working, hours, not salary. So, Society for Human Resource Management reported in 2009 only 25% of companies have accommodations for breastfeeding mothers. And this is the situation is worse for small businesses, and they're less likely to have these accommodations for women. So many women with no place to pump at work resort to using the restrooms, which is unhygienic. My sister just recently had a baby, and a lot of times we go out in public, and she has nowhere to breastfeed her baby, and there have been several times where she'd just go to a restroom and sit in there, which I think is gross, and she shouldn't have to do that. But if her baby's hungry, she doesn't, have a choice at that moment. Health services. So physicians have the duty to encourage and support breastfeeding, because breastfeeding has been backed up with evidence to be the best option for both children and mothers. It should be encouraged by physicians. But unfortunately, many physicians report having a lack of knowledge regarding breastfeeding. One study showed that many physicians believe the benefits of breastfeeding do not outweigh the problems associated with it or the barriers associated with it. So not only do they have a lack of knowledge, a lot of them just have negative attitudes towards breastfeeding. Women need clear construction and advice on how to breastfeed, how to initiate it, and many of them are not getting this type of counseling from their doctors. So, like I said, these negative attitudes and just the general lack of knowledge can discourage women from wanting to breastfeed. Okay, so in this report, the Surgeon General outlined 20 different actions to help foster breastfeeding. So originally, in my presentation, I wanted to have a discussion about these actions, and unfortunately I won't be able to do that, so I'll just kind of talk about them to myself. So for mothers and families, women should be provided with plenty of support and encouragement so that they will feel comfortable breastfeeding and do it successfully. They'll have the knowledge to do it. So that would also include different awareness or education programs, and not only for the mother but also for the father, so that they can also support the mother in breastfeeding. As far as the community, provide programs that foster support between breastfeeding mothers. So having support between mothers that are breastfeeding, or support groups between mothers who are breastfeeding. It can help, encourage them, and they can provide each other with advice or things like that. Have community organizations to promote breastfeeding. National campaigns to support breastfeeding. See that formula is marketed in a way that doesn't discourage exclusive breastfeeding. And not be misleading in any way. Okay, for healthcare, have maternity care that supports breastfeeding. So probably have paid maternity leave. That would help a lot. Have support for breastfeeding in different healthcare settings. Ensure all physicians providing care to women and children are knowledgeable on breastfeeding, so that they can consult with the women, help advise them, educate them, answer any questions that they need, and they are totally knowledgeable about breastfeeding, anything regarding breastfeeding. Have support for breastfeeding, a standard of care among healthcare professionals. Ensure women have adequate access to lactation consultants. Work towards greater availability of safe donor breast milk. So a lot of women don't just choose to not breastfeed. Many women just can't. And so having donor breast milk is a great option for those women. As far as employment, having paid maternity leave for all mothers. Employers should provide lactation support programs for employees. Provide means for working mothers to have better access to their babies. So for mothers who want to nurse, and not just pump all the time, but they want to nurse, allowing them to have breaks so that they could go see their baby at daycare, childcare, wherever they are. When I used to work at daycare, sometimes the mothers who would breastfeed would come in during their breaks and just come nurse their babies. And I thought that was great. All child care providers should foster breastfeeding in their facilities. So, yeah, when I worked in child care, we did everything we could to make sure that we could make breastfeeding a viable option for mothers. We had the space for them to store their milk. Just anything they needed, we would provide or help with so that they could breastfeed. Research and surveillance, increase funding for breastfeeding research, increase future capacity for breastfeeding research, have surveillance system to track rates of breastfeeding as well as factors that affect it. Public health infrastructure, have better leadership for the promotion of breastfeeding, which is important. All right. Thank you for listening to this. I appreciate it. And goodbye.